New COVID-19 cases continue to fall in the U.S., with some 31% of the population now fully vaccinated against the virus. It's a stark contrast to what we are seeing in India, where authorities report more than 400,000 cases this past weekend and a record number of deaths. Joining us now is Dr. Calvin Sun, founder and CEO of the Monsoon Diaries and clinical assistant professor and attending physician in emergency medicine here in New York City. Dr. Sun, thanks for being with us. We know that the pace of vaccinations have started to slow here in the U.S., yet we are still seeing a sharp drop in new cases. So I ask, how important is reaching herd immunity at this point for us to stamp out this pandemic?
I think if we can reach herd immunity, that would be ideal. But what we learned for last year, that ideal is always something that's very hard to reach, especially when you don't have 100% buy-in from the entire population. I spoke last month about how that was an inflection point, that the more people get vaccinated, the closer we would reach herd immunity and not have to deal with the possibility of having to revaccinate or booster immunity with a vaccination every year like we do with the flu vaccine. It seems like as it slows down, we're going to have to see that reality because 100% are not buying in to the vaccines as much as we want to. Of course, I can still hope, but also have to take into account that people are going to be less likely to get vaccinated when they see that the rates are dropping, and because of multifactorial reasons. The weather's getting better, it's getting warmer. We've seen how rates fall in summertime, just like with flu. And because people are seeing that but not thinking about it until I say it, fewer people are going to get vaccinated and less likely we're going to reach herd immunity.
When do you think we might be offered that booster shot?
I can't really make predictions, but I assume it's going to be later this year if it mirrors how flu rates get worse in colder seasons, when more and more people go inside again, get exposed, and not wear face coverings. Again, this could be another inflection point where people want to keep their face coverings, like we see in the populations of Asia after SARS and H1N1. If people keep on their face coverings, we obviate a flu season, like what we saw in Australia before our so-called faux flu season, which we didn't have because a lot of people in New York City kept on their face coverings. So we could avoid all of this. And if that's the case, we might need to see a booster every 2 years or every 3-4 years. It also depends on how fast the mutations are happening with COVID. And like what we're seeing in India, every single person that gets infected increases the chances of a new variant forming.
Yeah, I want to talk about India in a moment, but first just want to stick with the U.S. So you saw those new guidelines from the CDC saying that if you're fully vaccinated and you're walking outside, you can walk without your mask on, you can congregate with others who are vaccinated without masks on, even if you're inside. What do you make of that? I mean, it's starting to sound pretty confusing, I think, for a lot of folks. What's your personal take on the mask situation? And I would imagine you're fully vaccinated. Are you still wearing your mask when you go outside?
One of the first of the country. I was there on December 16th and proud of that. And fully vaccinated for the last 4 months. And yes, I wear face coverings, partly because I know it works and it's out of respect. A lot of the answers to these questions is the same thing how I would answer when I was a medical student and resident. The safest answers and the most accurate is, quote, it depends. A lot of conditions need to go with these recommendations that the CDC goes, but then too much information can seem so confusing. So they try to keep it as simple as possible just for the greatest impact. However, a lot of it still depends. I wear my face coverings if I know I'm going to interact with a large group of people, if I might go inside at any point, if I might encounter a lot of people who aren't vaccinated, if I want to deliver social respect to the spaces that I'm going to. However, if I'm going to be alone in nature where the only things around me are trees are not going to infect me with COVID, I'm not going to infect trees with COVID, then I won't bring a face covering for things where I do a lot of activities solo outdoors. Or if I'm going to interact with a group of people in a household where they're all fully vaccinated since January or December like I was. It all depends on what and where you do it, or not what you do, but how you do it.
Mm-hmm. I want to get your take on the devastation we're seeing in India right now. A record number of deaths, 400,000 new cases over the weekend. You know, at one point, India thought it had it under control, and then it all went haywire. Can you first talk for a moment as to how things got so bad there? Is it that they just weren't able to effectively vaccinate a large number of people?
It's a lot of different factors that has been contributing to this horrific second wave that they're experiencing. I mean, we tried to warn the world when New York City was hit horrendously bad about 13 months ago in March. 13, 14 months ago. And it's like the Cassandra complex. Some people listened, but most people did not. And we kept it low because we knew that it could happen at any point, especially in a city as dense as New York City. A lot of us share a small amount of space, and therefore, on the air side of caution, we kept ourselves locked down. We're not fully, quote unquote, reopen until July. That's the date we've been setting forth. Whereas plenty other places reopened really quickly. They fully reopened. In India, for example, there's a lot of things going on, like political rallies, big weddings. A lot of people who aren't getting vaccinated or the vaccines aren't rolling out fast enough. They've run out of vaccines. That they have announced that the vaccine centers are being closed right now in the middle of a second wave because they just don't have enough. As well as people just don't believe in it anymore. A lot of people that I speak with my colleagues, there's this fatigue with COVID. It's been on 13 months, 14 months in, and people are going to take their chances. And it's whether it's religious, cultural, or personal reasons, a lot of that is now creating this perfect storm in what we're seeing right now in India.
And we know that starting tomorrow, the U.S. is going to restrict travel from India to stop perhaps the spread of that virus or the variants we're seeing there here in the U.S. Do you think that was the right move? Will it really make a marked difference here for us?
I think that a life before COVID, I am a travel blogger. I'm an expert in this field, and to restrict travel from India is too simple. It's more of a symbolic gesture. Everyone feels like a little bit is better than nothing at all. But remember of all the connecting flights. Like for me, if I wanted to go India or come back from India, I take 2 to 3 connecting flights via Europe, via Africa, via all these different places to save the most amount of money. So to restrict travel only from India is very questionable unless all the other connecting regions and countries are restricted for India. I mean, we can get in a whole nother discussion on the nuances of actual responsible travel restrictions. But the biggest concern is the double mutants that are being seen in India. They have a variant that has a double mutant going on. I know some cases have surfaced in California, whether it's different or the same as the variant that we're seeing in India. We're still leaving up that for data to really definitively know. But to restrict travel because of this double mutant variant is an objective reason to do so. But remember, when you just restrict people coming from India, I mean, there are direct flights, but they're also restricting the connecting flights of all the people that come from India. That's also a big question, and whether the nuances are in place, that's up to a person being paid for a different job than mine.
Okay. I want to stick with travel for a minute because we know the European Union is actually looking at opening up its borders for non-essential travel as early as June. I know we're all sick and tired of it and want to get back to life as we knew it. But are these moves, do you think they're too much too quick and perhaps we could fall back into another wave?
I'm a big fan of gradual, responsible, ethical reopening, little bit by little bit, and then being able to, test drive it, and then be able to quickly, when you activate the circuit breakers, or to what in case driving a car, slowing down, cruise control, taking your foot off the gas pedal, and even braking a little bit, just so you have the best drive possible, the safest, most responsible, ethical, rather than just hitting, pedal to the metal. So if they're reopening immediately to anyone, that's a concern. However, are they reopening immediately to anyone who's been fully vaccinated? Then in that case, how are they actually checking for whether you're actually truly fully vaccinated or the legitimacy of your full vaccination, and whether people are actually defining full vaccination as at least 2 to 3 weeks waiting period since your last dose. You just can't get fully vaccinated and suddenly travel the next day because it takes 2 to 3 weeks for those antibodies to give you that as full of a protection. Also, what are the variants that are currently in the destination that they're going to, and the variants in the place they're coming from. If you're coming from a place with low rates and you're going to a place with low rates on a direct flight, that's very different from coming to a place like India to another place with a different variant where they can mutate together again and create a third variant. So it's this one-size-fits-all policy is very concerning, and I'm a big fan of maybe country-by-country specific destination-by-destination reopening guidelines that are very gradual, ethical, and slow. That I'm more in favor of.
All right. Hopefully they're listening right now. Dr. Calvin Sun, thanks so much for being with us.